Hello, my dear listener. My name is Nath, your antimicrobial steward, and in this brief video, I would like to talk to you about infection prevention and you. I would first of all like to shed some light on antimicrobial stewardship. What is antimicrobial stewardship? Abbreviated as AMS. Now, antimicrobial stewardship is a set of coordinated activities that we use to conserve antibiotics so that they continue to remain effective as arsenals that we use in the management of bacterial infections. Now, AMS can be accomplished by using antibiotics properly. Now, it's important to know that antibiotics are not an answer to all questions. Antibiotics only treat bacterial infections. They are not effective in the management of viral infections. Now, all healthcare facilities should have an antimicrobial stewardship program in place to drive the AMS agenda to ensure rational and judicious use of antibiotics in their institutions. Next, I would like to talk about what AMS means for the healthcare providers. Now, healthcare providers are now being more careful with the prescribing of antibiotics because they are quickly running out of options to manage the ever-challenging bacterial infections that they encounter in their daily duties. Now, once your provider discovers a bacterial infection, he or she will make a wise decision to identify the antibiotic that correctly covers the bacteria that you are dealing with. They'll also prescribe this antibiotic at the right dose and schedule it correctly so that you take it as frequently as is required and for the correct length or duration of treatment. Now, this will ensure that the bacteria are effectively eradicated. Now, antimicrobial stewardship programs are beneficial in many ways. They help ensure the proper usage of antibiotics, since improper use can drive the emergence of resistant strains of bacteria. Now, in the USA, annually, at least 2 million people are infected by serious strains of bacteria. They experience severe bacterial infections that are resistant to most of the antibiotics that they have at their disposal. Now, out of those, at least 23,000 succumb to their bacterial infections as a result of infections by strains of bacteria that are resistant. So what does AMS mean to you and me as individuals? Now, using antibiotics the wrong way can encourage or cause bacteria to transform into what we call superbugs, bacteria that cannot be tackled by most of the common antibiotics that we have in our arsenal. Now, this makes your next infection even harder to treat. When these superbugs reinfect you, eradicating them may be a tricky affair. So it's important for our healthcare facilities to have antimicrobial stewardship programs to curb or slow down the emergence of superbugs. Next, I would like to talk about what your healthcare providers can do as their contribution towards preventing the emergence of antimicrobial resistance. Now, your provider can follow an antimicrobial stewardship program to prevent antimicrobial resistance from emerging by limiting inappropriate antibiotic use. Now, in hospitals as well as in the outpatient clinics or settings, antibiotics are very frequently used even when they are not necessary, especially in the upper respiratory tract infections when the doctors are under pressure from patients to have antibiotics prescribed. Another example is when patients have the common cold or sore throat, for example. They may be anxious to receive quick relief and may therefore pressurize their prescribers to send them home on antibiotics. Now remember, antibiotics kill bacteria and not viruses. So having antibiotics prescribed in such situations is not beneficial to you as the patient. Now, when your provider follows what is stipulated in an antimicrobial stewardship program, they can also lower the chances of antimicrobial or antibiotic resistant bacteria from developing. And I would like to remind you that patients exposed to antibiotics are at a higher risk of being infected by antibiotic resistant germs, so they're in a position to avoid unnecessary exposure of their clients to these antibiotics. And remember, exposure of these patients to unnecessary antibiotics can drive the emergence of multi-drug resistant bacteria. Now, when such bacteria cause infection, they limit the way patients can be managed or treatment. In other words, infections caused by multi-drug resistant microorganisms are usually difficult to treat, and the antibiotics used to manage them are more costly and have more unbearable side effects. Now, through rational use of antibiotics, your prescribers can also help prevent the emergence of Clostridium or Clostridioides difficile diarrhea. Remember, this bacteria that is also a cause of what we call deadly diarrhea can increase your hospital length of stay, and it may prolong the duration you need to be treated with antibiotics. And since its eradication is difficult, it may increase chances of your readmission. Now, most cases of Clostridium difficile infection or diarrhea occur in patients who are taking antibiotics. This is because broad-spectrum antibiotics wipe out the friendly bacteria from our guts. Now, this gives a chance to spores of the Clostridium difficile a chance to proliferate, to multiply, and as they multiply and produce toxins, diarrhea emerges, what we call the Clostridium difficile diarrhea. So we should avoid unnecessary use of such broad-spectrum antibiotics when we do not need them, if we are to curb Clostridium difficile. And the doctors are in a position to do this through good stewardship. Now, recently, the CDC reported that nearly 500,000 Americans suffered from C. diff infections in a single year, and that an estimated 15,000 of those cases resulted in death. Now, in addition, a recent study showed that of 150,000 people who got C. diff infection, 82% were patients who had visited doctors or dentist offices in the preceding 12 weeks before diagnosis and not the hospital. So these infections can occur out there in the community. So we have to be vigilant, we have to be watchful, we have to try and curb it through responsible stewarding. So next, I would like to talk about what you as the patient can do to prevent the emergence of antimicrobial resistance. Now, the best way to help us in this war is to learn the ABCs of antibiotics, where A stands for ask your healthcare provider this question: are these antibiotics necessary for my condition? Before you take any antibiotics prescribed for you, because this will force your healthcare provider to think through carefully before describing or deciding to treat you with any antibiotic. Now, B in this acronym stands for bacteria. Now remember, antibiotics don't kill viruses, they only act on bacteria. So it's irrational to use them when the causative agent of the infection is a virus. So in other words, avoid their use in the treatment of upper respiratory tract infections that are majorly viral in nature. And C in this acronym means complete the course. Take all your antibiotics exactly as prescribed by your doctor, even when you get relief, even when you feel better, as this lowers the chances of the bacteria regrouping to rebound with a bang. It lowers the chances of leaving traces of bacteria which may multiply and continually proliferating into superbugs or drug-resistant microbes that may be difficult to eradicate. So I would like to urge you not to pressurize your healthcare providers to prescribe antibiotics for you, especially for the treatment of common colds, most coughs or bronchitis, sore throats, apart from those that are caused by strep, runny noses, and most ear infections, since most of these are viral in nature and antibiotics do not work in such infections. So in summary, I would like to emphasize that an effective antimicrobial stewardship program can provide an organization with the tools needed to 1. Prevent the overuse of these finite resources, and 2. Help control the increase of antimicrobial resistance. So I urge you, my fellow listener, my dear listener, to join those of us advocating for the rational use of antibiotics. AMS is a difficult battle which requires a multidisciplinary approach. if we are to succeed in this battle, we must fight it together. We owe this victory in the AMS battle or journey to the future generations to come. If we don't play our bit, superbugs will emerge and we will lack the right arsenal to manage infections caused by these superbugs. So thank you very much for your attention. My dear listeners, I urge you to join me in good stewarding. And if this video helped you in any way, make sure you give it a thumbs up and do remember to subscribe to my YouTube channel. The best is yet to come. Thank you for watching and listening, and have tremendous antimicrobial stewarding. Thank you all.